As the number of coronavirus cases surges, we are looking at how the virus affects men and women differently. While they get infected at similar rates, research shows that men are more likely to suffer worse outcomes. They are as much as 2.4 times more likely to die, for example. Senior medical correspondent Dr. Narula reports that doctors are now seeing if giving men so-called female hormones can help.
When COVID-19 hit the Bagazzo family in April, Leo Bagazzo was more worried about his wife, Carolina, who had a history of pneumonia and asthma.
I don't have asthma, I don't smoke, I don't have COPD, I don't have hypertension, high cholesterol, nothing. She'll recover faster and easier. And actually it was the other way.
While Carolina got stronger at South Bay Hospital near Tampa, Florida, 2 doors down, Leo was intubated. Doctors gave him only a 40% chance of survival. 1 month after his triumphant homecoming,
welcome home,
Leo was still weak and needed supplemental oxygen. Why a healthy man like Leo got so much sicker than a woman with underlying conditions is likely due to a combination of behavior, genetics, and hormones.
One of the biggest questions that I have is the extent to which these differences between men and women are being mediated by our hormones versus our genes.
Sabra Klein studies gender differences in immune response to viruses and vaccination at the Johns Hopkins Bloomberg School of Public Health.
When something like a virus, like the SARS-CoV-2 virus, enters our bodies, the immune system of women tend to respond more rapidly and more robustly.
With other viruses, such as the flu and hepatitis, women tend to clear the infection faster than men, and women generally mount stronger immune responses from vaccines. The advantage may lie in the X chromosome, which carries genes linked to immune system function. While women have a pair of X chromosomes, men have only one.
I think there's more than one reason or one thing that's potentially contributing to women faring better in this disease.
Dr. Sarah Gandahari is studying whether the COVID-19 gender gap could be linked to the hormones that make men and women different: estrogen, testosterone, and progesterone, which supports pregnancy.
The hope is that progesterone will get to the disease when it's at a level that there's not an overwhelming amount of inflammation.
40 men with COVID-19 in Dr. Gandahari's study will receive a 5-day course of progesterone to see if it raises their odds of surviving on par with women.
I really wasn't expecting my dad to get as bad as he was. I really expected the kind of roles to be swapped.
When Brianna Lawton's family got infected with the coronavirus, the Florida nurse thought her mother Cecilia was most at risk because of her history of high blood pressure, diabetes, and respiratory illness. But while Cecilia recovered at home,
it just happened so fast.
Her husband Marvin lost his battle with the coronavirus and died in the hospital. He was only 60 years old.
We got that call. To me, it just seemed like, this has to be somebody else. It couldn't be us. My daughter struggles with the guilt that she couldn't save her dad.
And Dr. Narula joins us now. Doctor, we mentioned genetics, we mentioned hormones as possible contributors to this gap. Could it also be the way that men behave, the things they do to their bodies to begin with?
Absolutely, Tony. It really is this complex interplay between genes, hormones, and behavior. We talked about the X chromosome genes in the piece, but even the same genes that we share, some in men can be turned on differently than the ones in women. When you look at hormones, all of our immune cells, almost all of them, have receptors for estrogen, progesterone, and testosterone. But you can't discount the behavior. We know that men tend to smoke or drink more than women. They may seek care less often or seek care less quickly if they have symptoms than women. There may be different occupational exposures, and even studies have shown that men tend to wash their hands less often. So all of those are important to factor in.
All right, Dr. Narula, important reminders there about how men can intervene on their own behalf if they choose to. Thank you very much.